Welcome to the first lecture of the urinary system. In part 1 today we're going to do a urinary system overview. We'll also talk about the very beginnings of urine production. This is lecture 15 and the material is coming from chapter 25 in Marib. Before we go into the details of the kidney, I wanted to show you some of the functions of the urinary system just to give you an overview. First of all, we know that the kidneys will produce urine. This is the body's primary way of excreting liquid waste. The kidneys are also very important in regulating blood volume and blood pressure. One of the primary ways they do this is through the renin, angiotensin, aldosterone system that we talked about earlier with the endocrine lectures. Now the next two functions that you see here, we're going to talk much more about when we talk about water, electrolyte, and acid-base balance a little bit later. But the kidneys are important in regulating plasma concentrations of important electrolytes like sodium, potassium, chloride, bicarbonate, some others. They also regulate concentrations of hydrogen ion in the plasma, thus they help control blood pH, very important function. The kidneys are very good at conserving valuable nutrients, for example, glucose, amino acids, as well as some others that we'll talk about later. And finally, the kidneys assist the liver in detoxification and the process called deamination that we talked about earlier. Recall this is the removal of amino groups from amino acids so that we could use those amino acids for energy or convert them into other molecules. By way of overview, the urinary system consists, as you see here, of paired kidneys, one on each side, paired ureters, which are muscular tubes that transport urine from the kidneys down to the urinary bladder, the single urinary bladder, which is an expandable organ that can hold quite a bit of urine until it's convenient for us to urinate, and finally, coming from the urinary bladder is the urethra, which is the muscular tube that leads to the outside of the body. Now, as you see on the bottom of the slide, the kidneys receive about 20% of the cardiac output. Quite a bit of blood has to pass through the kidneys because this is primarily their job, to take the plasma from the blood and filter those things that we don't want, excrete them in the urine, and take back those things that we want to keep in the body. Consequently, we need a high volume of blood passing through the kidneys, so 1.2 liters of blood every minute. And the kidneys filter out about 180 liters of fluid from the bloodstream every day. Now, to give you some idea about that, imagine taking 92-liter bottles of some kind of beverage like soda or iced tea off the store shelves at your supermarket, putting it in a cart, bringing it out to the car, putting it in the car, transporting it home, bringing it from the car to your house, and then putting all those 92-liter bottles away. That's how much fluid the kidneys move every day. Now, when we say filter, we don't mean excrete. We couldn't excrete anywhere near 180 liters per day because we don't have that much fluid in our bodies. We'd be dehydrated after several minutes if we did this. What the kidneys do, however, is they take this 180 liters of fluid, and as we'll see from that, they reabsorb about 99% of this, and we wind up excreting on average about 1.8 liters of fluid every day as urine. And we're going to talk about some of those numbers and some of the particulars a little bit later on. The diagram at the right here you'll see is what we call a pyelogram. And you can actually see this is a procedure in which contrast media is either given IV or sometimes through the urethra and up this way. This is called a retrograde pyelogram. And you can see the outline of the kidneys here, and these tubes that are leading down here will lead to the ureters, as you can see, and then down to the urinary bladder, which is right here. So this is a way of visualizing the urinary system to see if there are any blockages or any abnormalities. Now, in terms of where the kidneys are located, these are retroperitoneal organs. Remember earlier with the digestive system, we talked about the term retroperitoneal as meaning behind the parietal peritoneum. So covering the kidneys is the parietal peritoneum. These are located along the back body wall, approximately at level T12 to L3. You can also see that the left kidney is usually slightly higher than the right kidney. And one of the reasons for this is, remember, we have the large liver located right over here. As we talked about with the endocrine lectures, remember the adrenal glands sit on the superomedial pole of each kidney. You'll also notice that the ureters that we mentioned before are also retroperitoneal structures. In other words, the parietal peritoneum covers these as well. And finally on this slide, you'll notice the root word for kidney is nephro or nephros. So for example, when we talk about nephrons, these are going to be the basic units of function in the kidney. Nephritis would mean an inflammation of the kidney. Now let's take a transverse section through the level of about L1 and take a look at a cross-section through the kidney and some of the supporting tissues. First of all, we can see the kidney right here, And one of the things I'll point out is that the kidney is surrounded by a renal capsule. As we saw with several other organs that have capsules, the kidneys have a connective tissue capsule that helps keep the kidneys intact. The second feature you'll notice is that the kidneys are surrounded by something called a renal fascia. This is this thin strip of white tissue that you see right here. Remember, fascia come in several varieties. We had a subserous, we had a deep fascia, and we also had a subcutaneous fascia. This type fascia that we see here is one of the deep fascia that we have in the body. This is a very strong fibrous sheet of connective tissue that helps to hold the kidneys in place. And finally, surrounding the kidneys, you can see out here that we have a lot of adipose tissue. The adipose tissue is also something that helps hold the kidneys in place. In fact, in people that lose a tremendous amount of weight, they lose so much fat that the kidneys actually drop. This is something known as ptosis, P-T-O-S-I-S, ptosis. And what that can do is that can actually kink the ureter, which is the tube coming from the kidneys down to the urinary bladder, and cause a backup of urine in the kidneys. One of the things I'll point out, although we'll look at this later, is this space right in here that's known as a renal sinus. This is the space where the tubes come in and out of the kidneys. And we'll come back to that in a little while. You'll also notice the term that we've seen before, which is the hilus. This is the entry point right here for blood vessels and tubes that come in and out of the kidney. This is the hilus, remember, or we also call this the hilum. Now let's take a look at the gross anatomy of the kidneys just to get an overview of these. You'll see a coronal section through the kidneys here. We can divide the kidneys up into two major areas. The outer portion is known as the cortex, and that's this area that you see shaded in this lighter color that's on the outside. So it goes from here to here. And then the inner area is known as the medulla. And in the medulla, you can see these triangular structures that are known as renal pyramids. So the entire medulla of the kidney I'm tracing around here contains all these renal pyramids. All this area that is in here is called the medulla of the kidney. You'll also notice that we have extensions of cortical tissue that actually pass down between the renal pyramids. The extensions of cortical tissue that we have here are also known as renal columns. One of the things we pointed out before is that the kidney is surrounded by a renal capsule, which is a tough fibrous capsule, and this is sometimes known as the tunica fibrosa. Now let me talk just a little bit more about the renal pyramids. A renal pyramid is this structure here that has a roughly triangular shape in 2 dimensions. Since we're taking a cross-section through these, they look like triangles, but in 3 dimensions, as we'll see when you look at the laboratory models, these are actually shaped more like pyramids. Each renal pyramid has a broad base that's right here, and the base is located at the junction of the cortex, which remember is out here, and the medulla. The junction between the cortex and the medulla is known as the cortico-medullary junction. As we go deeper into the medulla, you'll notice that each renal pyramid has what we call a renal papilla, which is located right here. This is the pointy end of the pyramid. You'll also notice that each pyramid has these stripes or striations running through it. These are actually tubes that are transporting urine from the cortex down to the renal papilla, and the urine will basically dribble out into this area here and then be transported eventually down the ureter down to the urinary bladder. Now the place where the urine comes out from the renal papilla and gets trapped by an epithelial tube is known as a minor calyx. And you can see that area right here. Notice that each renal papilla has its own minor calyx, so we see 4 of them down here. Also notice that the minor calyces will merge into a larger area right about here that's known as a major calyx. And then the major calyces, we see 1 here, we see a second one here. These are going to merge into a larger structure that's known as the renal pelvis. The root word for pelvis, as you see here, is pyelo or pile. So a pyelitis, for example, is an inflammation in the renal pelvis. And as you can see, the renal pelvis is nothing more than an expanded area that goes from about here to here at the upper end of the ureter. So finally the urine comes down here, goes into the ureter, and then eventually makes it down to the urinary bladder. Now, in terms of the pyramids again, you'll notice that we have a structure called a renal lobe. And a renal lobe is the pyramid plus the cortical tissue on either side of the pyramid plus the cortical tissue up here near the base of the renal pyramids. So all of the structure that you see outlined in this black line right here is known as a renal lobe. Now another thing you'll notice is that in this area right in here, we have a number of tubes and blood vessels, and we also have some adipose tissue. If we took all this out here and just considered the empty space that's right in this vicinity, This would be known as the renal sinus. And as we saw before, we have the hilus of the kidney right here. This is the point of entry and exit of tubes and blood vessels, as well as some nerves. Okay, let's talk a little bit about the blood supply to the kidney. Remember that the blood is a very important part of how the kidney works, because what it does to make urine is to filter the plasma and then work on the plasma, retain those things that we want, get rid of the things that we don't. So let's start looking at the blood supply of the kidney by looking first at the renal artery. This brings blood into the kidney, of course, and then these divide almost immediately into a couple of large segmental arteries. In turn, the segmental arteries then divide into what we call interlobar arteries. Remember, we defined a lobe of the kidney before, and I told you to remember that. These interlobar arteries run between the lobes of the kidney. Once these arteries reach the corticomedullary junction, they turn about 90 degrees and arc around and span the corticomedullary junction. These are now known as arcuate arteries. So these run perpendicular to the interlobar arteries. Importantly, coming from the arcuate arteries, we have smaller arteries now called interlobular arteries. Now, these vessels are also sometimes called cortical radiate arteries to eliminate any confusion between interlobar and interlobular. So this is the newer nomenclature, cortical radiate arteries. These are very important because, as we'll see in a second, these feed the small structures in the kidney that begin to make urine. Now, the venous pathway out of the kidney basically parallels the arterial pathway in. So we have interlobular veins, and then we have arcuate veins, and then the arcuate veins lead to interlobar veins, and the interlobar veins in turn lead to the renal vein, which takes blood away from the kidney. The only difference between the arterial and the venous circulation, as you'll see, is that there's no segmental veins. We have segmental arteries, as we mentioned before, but there are no segmental veins. That's about the only difference between the arterial and the venous blood supply of the kidney. Now let's turn our attention to the right-hand panel of the slide and look at a couple of things in a blow-up of a typical lobe in the kidney. You'll see the corticomedullary junction right here, and of course you see the renal pyramid down here. Just to review, remember these vessels that go up between the lobes are known as interlobar arteries, and then we also have the arcuate arteries that branch around about 90 degrees at the corticomedullary junction. Coming from the arcuate arteries, as we said before, we have the interlobular arteries, the newer name for these being cortical radiate arteries. Now let's take a look a little further at how the vessels branch following the interlobular arteries. Notice we go into next smaller vessels that are known as afferent arterioles. And of course, as we said early on when we talked about the circulation, remember arterioles govern circulation into capillary beds. You'll see the small afferent arterioles right here, and hanging from the afferent arterioles we have these small spherical structures that look like this. And these small spherical structures are known as glomeruli. Glomeruli are nothing more than small tufts of capillaries that will begin filtering the plasma to start making urine. Now, one of the things I'll point out since we're here is this structure, which is known as a nephron. The nephron is actually the fundamental structural and functional unit of the kidney. In other words, this is the structure that will begin making urine, take things from the urine that we don't want to get rid of, bring them back into the body, and excrete those things that we want to get rid of. So the nephron is the functional unit of the kidney in terms of making urine. And you'll notice the junction between the glomerulus and the nephron right here. And we're going to come back to that and talk much more about the nephron very shortly. While we're here, let's take a look at the renal pyramid. You'll notice once again through the renal pyramid we have these stripes or striations that go down toward the renal papilla, which was right here. These striations in the renal pyramid are created by these tubes, which are known as collecting ducts, which receive the urine from each nephron, collect it, and then drain through the renal pyramid down to the renal papilla. The renal papilla drains into a minor calyx, as we saw before, and you'll notice in here in this diagram that the minor calyx is illustrated as kind of a cup that's going to catch the urine that comes out here and is going to funnel it eventually into the major calyces, then to the renal pelvis, and then finally to the ureter, which leads down to the urinary bladder. Now, one of the other things I want to note is that we have mainly sympathetic postganglionic fibers of the autonomic nervous system that basically follow the blood vessels into the kidney and wind up controlling the state of the arterioles up here. And we're going to talk about that very important control in a little bit. Now let's talk a little bit more about the nephron. By way of overview, you'll notice that there are two different types of nephrons. we have nephrons that for the most part are located in the cortical region of the kidney. These are known, not surprisingly, as cortical nephrons. This constitutes about 80% of all the nephrons that we have in the kidney. You'll notice that only a small segment of them right here dips down into the medulla. Remember, this portion right here is the corticomedullary junction, and so down here would of course be the medulla. Now we have a second type of nephron that's known as a juxtamedullary nephron. This is about 20% of all the nephrons. Juxta meaning nearby, medullary of course referring to the medulla. You'll notice that these have a very, very long loop that dips far down into the medulla. And as we'll see a little bit later, these are actually the nephrons that can concentrate the urine and decide whether or not the body should get rid of more water or less water. As I mentioned before, the nephrons are the structural and functional units of the kidney, so these are very, very important structures. A little bit more about the blood supply of the nephron, just to give you a look at how this works. You can see the nephron here, and you can see that the nephron basically consists of a series of tubes. These are epithelial tubes consisting mainly of cuboidal type epithelium, so a simple cuboidal type lining for all of these tubes. And up here you'll notice a glomerular capsule that interfaces with the glomerulus, which we looked at before. So to review how the blood gets to the glomerulus one more time, we have the corticomedullary junction indicated here at this dashed line. So these vessels right here are arcuate arteries, the one that I'm tracing right here. These give rise to the interlobular arteries. Remember, these are also called cortical radiate arteries. From here, these give rise to afferent arterioles. And the afferent arterioles then go into the glomerulus and form this capillary tuft that we refer to as a glomerulus. You'll also notice that coming from these capillaries, we have a vessel, basically an arteriole, coming right out of the glomerulus. This is known as the efferent arteriole. So hopefully you remember what we called something that had capillaries in series and didn't have this normal kind of circulation that the rest of the body has. This is basically a portal system. So we go from the glomerulus via the efferent arteriole, and the efferent arteriole then forms the vessels that wrap around all the different epithelial tubes in the nephron. These are known as peritubular capillaries. Now the peritubular capillaries go down and follow this long loop that dips down into the medulla of the kidney, which we see outlined here. And when we have long straight loops that parallel juxtamedullary nephron loops, we refer to these as vasa recta. Literally in Latin this means straight vessels. So these are very long loops of capillaries that go down and parallel the nephron loops in juxtamedullary nephrons, and we give those a special name, vasa recta. For the most part, the other blood vessels that surround the tubes are just known as peritubular capillaries. Now the blood flow through the kidney and nephron is important for you to know. Here's a nice schematic summary of this. The only thing that's omitted here is, if you remember, we talked about the renal artery dividing into first segmental arteries and then going into interlobar arteries. So I don't want you to worry about the segmental artery nomenclature right here. For our purposes, we can consider the flow that you see right here to be exactly what the flow is. In this case, if we eliminate the segmental arteries, then the flow into and out of the kidney is the same. So this is a pathway that you should know. Let's go on and talk a little bit more now about the glomerulus and the epithelial structures that are the tubules of the kidney, of the nephron, that surround the glomerulus. Let's revisit first of all the afferent arteriole, which is right here. Remember that the afferent arteriole is a branch of the interlobular artery, or cortical radiate artery, and the blood of course comes in from the afferent arteriole, afferent meaning two, into the glomerulus, which you see here is this tuft of capillaries. And then from this tuft of capillaries, the blood comes out the efferent arteriole, and from what we just said a couple of seconds ago, remember this leads to the peritubular capillaries. And some of these go down and parallel these long loops that we have in the juxtamedullary nephron, and we call those vasa recta. Now the second thing we want to talk about is about the epithelial cells that make up the tubules of the nephron. First of all, you notice that we have this cup that surrounds the capillaries in the glomerulus. This cup is known as a glomerular capsule. It's sometimes also called Bowman's capsule. And the capsule is made up of epithelial cells. You'll see that there's a simple squamous epithelial lining around here. And the cup has actually two layers, similar to what we looked at when we looked at serous membranes in the body. We have an outer layer that's out here, And this comes around to an inner layer, and the inner layer of these cells are actually directly adherent to the capillaries themselves. So this is a two-layered structure. The space in between is very important. This forms what we term a capsular space. And in fact, what happens is the plasma from the blood is squeezed out past these cells and comes into the capsular space here. And this is going to be the very beginnings of urine formation. What we call the fluid that comes out of the plasma and gets squeezed out into the capsular space is now filtrate. It's not, as we'll see, exactly like plasma, but it has most of the things plasma has in it, but because it's not exactly like plasma, we name it something different. We refer to this now as filtrate. So, because we have two layers of this capsule, the outer layer of the capsule is known as the parietal layer. The inner layer of the capsule, the one that's directly adherent to the capillaries themselves, is known as the visceral layer of the glomerular capsule. Now, coming from this cup that catches the filtrate is the first portion of the nephron after that, which we term the proximal convoluted tubule. And we're going to go back and talk about the different tubules and structures in the nephron in a little bit. Now, let me introduce another concept here. You'll notice that the afferent arteriole has a larger diameter than the efferent arteriole shown here. And basically what that's going to do is it's kind of like having a hose that has a constriction in it, where we have a wide part of it here and then a narrower part here, and the fluid is going this way and having to flow through this. This little constriction that we have right here creates a high pressure. The same thing would be true in the glomerulus, where we have a large tube going in and a small tube coming out. This creates a very high pressure in the glomerular capillaries themselves. In fact, the pressure is up around 55 to 60 millimeters of mercury inside the capillary bed of the glomerulus. Now, if you remember back to when we talked about the systemic circulation, we talked about the arteriolar end of the capillaries having a pressure of around 40 or so millimeters of mercury. So you'll see that this is about 15 to 20 millimeters of mercury higher than typically what we have in the systemic circulation. And we'll talk about the reason for that in a little while. What I want you to note, though, is that this high pressure inside the glomerulus exists because we have two different sizes of vessels, a large one bringing blood in, a smaller one bringing blood out. This is a nice scanning electron micrograph of the visceral layer of the glomerular capsule. These cells that actually sit right on top of the capillaries and form the visceral glomerular epithelium are known as podocytes. Podo meaning foot, cyte meaning cell. So these are foot cells. And what they do is they have small processes that look kind of like little toes that come out, and you can see them pretty well here. And these little toes interdigitate. In other words, we have the little feet of one cell sticking out like this, and we have the feet from a nearby cell coming out like this. So they interdigitate, kind of like your fingers would if you put them together. And between these cells, we have very narrow slits. These are known as slit pores. And in fact, one of the things that the plasma has to do before it gets to the capsular space, which is out here, is it has to squeeze through these very small slits. Not surprisingly, what makes it out into this capsular space is pretty much everything except molecules that can't fit through those slits. And we're talking about things like albumins and any protein that's larger than albumin. So for the most part, many things make it out into the filtrate except proteins. We leave those behind in the capillary blood, and they exit the glomerulus through the efferent arteriole. In the last slide, I just want to show you a side-by-side comparison. There are two histomicrographs here, one of the renal cortex, which is shown on the left, the other of the renal medulla, which is shown on the right. If we look at the renal cortex, first of all, you can see this vessel right here. This is actually an interlobular artery or a cortical radiate artery. Coming from that, remember, we have vessels that we refer to as afferent arterioles. This would be a glomerulus, and this would be a glomerulus over here. So these are the small tufts of capillaries that we have. I want you to notice right outside the glomerulus this thin layer of cells that I'm kind of outlining right here. This is the glomerular capsule. And you'll notice that we have a simple squamous lining in the parietal layer of this capsule. And then inside, you'll notice that the capillaries are covered by those podocytes with their little pedicels and slit pores, and this is the visceral layer of the glomerular capsule. The other thing I'll call your attention to is notice the tubules that we have here. Inside these tubules, you can see it looks a little bit fuzzy in certain places. Remember, I said before that the lining of most of these tubules is simple cuboidal type epithelium, and it turns out that these epithelial cells, I know you can barely see it here, but actually have microvilli on their surface. One of the things, remember, that microvilli is suited for is to increase surface area and increase the absorptive capability of cells, and that's exactly what the microvilli do here. These cells take the filtrate from the capsule and then will eventually try to take things out of it that we don't want to get rid of. For example, glucose, as I mentioned before. So the microvilli help these cells do their job in absorbing things that we don't want to lose from the body. Now, if you look at the slide on the right, you'll notice that the open area, the lumen of these tubules here, is much cleaner. We don't really see any microvilli here, and in fact, these are collecting ducts. Remember, I said that the collecting ducts led to the renal papilla and eventually drained into the minor calyx. These are really purely just for transporting urine down to the renal papilla. So they don't need microvilli to reabsorb things. Although, as we'll see, one of the things they can do is reabsorb water. But we don't need microvilli to do that, as we do in the cells of the proximal convoluted tubules and the tubules that are nearby to the glomerulus. Okay, so that finishes up part 1 of lecture 15. Just a general introduction to the kidneys, the blood supply. What we'll do next time in part 2 is we'll pick up with filtration at the kidney and then begin talking about how urine is made. I'll see you there.